these have been incredibly valuable for us in Healthwatch. We've heard some very positive accounts, which is fantastic, and sadly we've heard some less than positive experiences. What we do want to do is recognise that everyone is in this together. It has been a difficult year, and yesterday was our day of remembrance, and I'm sure that will be a regular feature going forward. But it is something, particularly with the care home visiting and what's happened in care homes, this is something that we think if we can work together on this, it will achieve better outcomes for family carers. Through these webinars, we've built up some connections, and we hope to sustain these connections, particularly with the family carers that we've met along the way. So we hope we will continue this journey with you. We're delighted that this work has actually attracted some interest from further afield. So we have been approached by a university that's doing a study, so we will share that information with participants as well, which is great news. We also believe that this has been a safe space for family carers, and we want that to continue as well and find new ways of achieving that. And our colleagues, I'm sure, will talk about that. So today we're going to end the session by asking our panel firstly to introduce themselves, and then we are going to ask them to share briefly what their organisation has been doing since the 8th of March, and any pledges they're making to make this transition to visiting happen as smoothly as possible. So I'm going to introduce our panel members. We've got Dr. Padma. Evening, Dr. Padma. Do you want to introduce yourself?
Hello, I'm Padma Dolby, and I'm a clinical psychologist. I'm the clinical director of Older People Services in Sussex Partnership Trust, which is a mental health and learning disability trust. And together with colleagues who are on the call today, I've been running a care homes wellbeing service through the last few months in response to the COVID pandemic.
Thank you. And I didn't see that we'd admitted Deborah. I'm not sure she's on the call.
Yeah, she's here. Deborah's here.
My apologies. Would you like to introduce yourself?
We can't hear you, Deborah.
I see you're off mute, but I can't hear you. It's going to be one of those sessions, isn't it? We'll come back to you, Deborah. Rosemary, are you on the call with us?
I am. Yes. Hello.
Good evening, Rosemary. Would you like to introduce yourself?
I'm Rosemary Pavoni. I'm chair of West Sussex Partners in Care, which is our local care association, and I own and manage a care home in Horsham.
Thank you and welcome. From Public Health, we have Daniel.
Hello, I'm Daniel McIntyre, consultant in Public Health with West Sussex County Council.
Thank you, and thank you for joining us. We have Lee from West Sussex County Council.
Hello, I'm Lee Jenner. I'm the Interim Commissioning Lead for Supplier Management and Quality Assurance in Adult Services at West Sussex County Council.
I think you've won the job title there, Lee. That's
Yep.
Epic job title, isn't it? And joining us from the West Sussex West Sussex Clinical Commissioning Group, we have Jackie. Good evening, Jackie. Would you like to introduce yourself?
Yes, I'm Jackie Nettleton, and I'm Head of Integration for West Sussex CCG, and care homes fall under my portfolio.
Thank you. And Sonia from Carers Support.
Hello, Sonia Mangan. I'm the Chief Exec for Carers Support West Sussex, and just to remind you that I have a couple of colleagues here as well, Susanna and Pam, who are also from Carers Support West Sussex. Thank you.
Thank you. And as we've got you on the screen, Sonia, would you like to kick off for us? And we're asking our panel members just to run through what their organisation has been doing as part of this work.
Kat, I loved the questions. Done, difference, differently, and pledge is what I've got written down in front of me here. So done. Carers Support West Sussex is a large carers organisation. Remember, in this context, always we're talking about family and friend carers, and we support at the moment about 30,000 carers. And according to the last census, not the Sunday one, there was 89,000 carers in West Sussex. We actually predict there's probably about 120,000 carers in reality if you ramp it up and think about all the things that we've just gone through over the last year. What have we done? Well, what we've done is we did attempt at the beginning of the pandemic year to reach out to care homes to remind care homes that family friend carers we can support. So we did that right at the beginning. The other thing that we did was take some of those carer stories and actually try with public health to identify what some of the key issues were quite early on in terms of the visiting restrictions. And we did that not just with public health, but we also did it with CQC and with Healthwatch. And we also work very practically with some family friend carers around things like helping them to access iPads, other equipment, mobile phones, all the things that we do for carers in the community. We did that support for family friend carers. The difference that we have made, well, I think the difference that we've made is been about joining in this collective response that we've worked on with Healthwatch in Sussex and with colleagues from the NHS and with family friend carers, because I think that's been quite a significant difference, because at least we have been able to create some kind of movement around bringing what people's experiences are, quite heartfelt experiences, and trying to make sure that things are done differently. What would we have done differently? We'd have been connected with care homes much better. We could have been better connected before we started 2020. And I think in terms of pledge for us is, as an organisation, we need to reach out to our care homes that are in West Sussex to make sure that everybody within those care homes understand that organisations like ours are there to help. You know, that we've got things like carer support groups, we've got equipment, we've got support, we've got a listening ear for carers, and just to remind people that that exists. I think it's so difficult to think of what it means like to be a carer, but I think we all pride ourselves on this call in remembering that actually it doesn't stop just because somebody goes into 24-hour residential care. So that would be our pledge, would be to reach out better in the future with our care home providers.
Thank you, Sonia. Very well put. Padma, can we come to you next? Same question.
Yes. I'm not sure I've planned all the answers to those questions because we're suddenly doing something different. But anyway, well, working in a big mental health and learning disability trust, it's really important for us to be working in partnership with carers. So within the trust, we have a value base called the Triangle of Care, in which we think about the triangle of care as being the person who's receiving the care on one point, the person's carers, family and friend carers in another point, and the third point being the service provider or professional provider of care. And that's a thread that we aim to run through our work all the time. So that's the context in which we work. And then in response to the COVID pandemic, well, really early on in the COVID pandemic, I was really aware and concerned, particularly of care homes and of older people at home as well. And I did really early on try to get some funding to set up the Care Homes Wellbeing Support Service. And what could have been done differently is maybe I could have managed to get that money a bit sooner, because we got funded to deliver that service from November, and Deborah and I and 2 other colleagues have been running a service in which what we've had in mind is the whole care home community. So the residents of the community, the family and friend carers and the staff, and trying to support the communication and the well-being of that whole community. And our work with Healthwatch and the carers organisations has been part of that. And I have to say these webinars have been a real privilege to me to be able to be involved with, to meet family and friend carers direct, and to offer you a space, and to hear some of the stories and challenges and really difficult things you face, but also your resilience and the way in which people, in the second part of the sessions that we've held, which have been more private, the way in which people have supported each other as well. So as we go forward, what I'm really interested and passionate about is to build on this work that we've been doing together. So I think it's been a great place in which carers' voices have been heard, have been listened to. You've been able to hold other organisations to account, and I know that Healthwatch and the carers organisations have taken away issues that you've raised and lobbied on your behalf, the appropriate places. So I hope that we can continue to support your voice being heard. And you've also together created an environment in which you can support each other, and also recognise the ways in which the carers organisations are there to support carers of people who live in care homes. So I hope that people attending the webinars have really become aware of what support is out there, as well as being able to articulate more what support you feel you need as a family or friend carer of someone living in a care home. And what we'll be doing in our organisation is really working across the health and care system to try to advocate on your behalf, and to basically ask for more support and resources to meet your needs. So our Care Homes Wellbeing project is, the pilot is coming to an end, but we're in the process of exploring new ways in which we can support that work going forward.
That's brilliant, thank you. And Deborah, do you want to talk, if we've got you able to talk at the moment?
I think I'm speaking
Super.
now. It just required me to go in on another laptop. That's all. So sorry. Yeah, just to add to Padma's, really, just very briefly, how coming to the Healthwatch webinars and listening to carers has really informed some of the sessions that we have been doing with our care home communities. So the webinars that we've been running for staff, but also supporting residents and carers, particularly around maintaining that sense of connectedness when it's been so challenging and continues to be so. But, you know, from what we're hearing yesterday, visiting is still quite limited. So we've been able to work with our care home colleagues to pick up on those things and kind of make that bridge really between the two, when communication has been difficult, even though, you know, people have tried really hard. It's not the same as having those face-to-face conversations. But thank you to all the family friend carers that are here today and have been throughout the other sessions for their openness, their honesty and their time. It's made a real difference.
Brilliant, thank you. If I can move to Daniel and public health, would you like to sort of run through some of your, obviously you've been doing a lot of work in general, but perhaps focusing on the care home work.
Yeah, certainly. I mean, as you highlight, we do have sort of central roles and responsibilities relating to COVID. I think in terms of the care home work, and I think my answers here will chime with Jackie from the CCG, because we've been working hand in glove with NHS colleagues and also colleagues in adult social care. I think our focus has been on to make the care home environment as safe as possible so that those connections can take place, to reduce risk, to enable visiting to take place. I mean, looking at outbreak control for one example, you know, working very closely with CCG colleagues, adult social care colleagues, to control and manage outbreaks. And I think to give people some sense of the scale, between December and February, we were involved in outbreaks in 175 of the different care homes in Sussex. That's half of West Sussex. That's half of all the care homes in West Sussex. Thankfully, very different picture at the moment. I think one of our sort of other key roles was trying to interpret and align the large amount of guidance that came through at high speed and make sense to colleagues in the system, people in care homes, different groups. You know, it was very difficult to make sense of it all. You know, we had a role in providing the sort of technical expertise there. I think, you know, something else that we have been doing is just providing a picture of COVID within West Sussex, i.e. making available to the public on a daily basis the number of new cases, the current picture, so people can get a sense of the wider context. And I think that's important for care home providers and for carers themselves, just to get a picture of what is the actual situation re-COVID in West Sussex. I think looking at what we could have done differently, if anything, you know, more timely guidance and communication. I think it's been very, very difficult for both carers and families and the providers, that the pace and the turnaround time for guidance, things coming out that will have an instant impact on people. And we've been, I think, working closely with system partners saying, look, we just can't have this guidance coming out at this pace, you know, and sort of trying to challenge that and move forward. So I think that definitely needs to change. And I think going forward, maintaining our commitment to the care sector, to make the settings as safe as possible, to continue to provide support, to enable, you know, carers and family members to keep those connections.
Thank you, Daniel. And I know that your team have actually been working with individual homes that may have been reticent to allow visiting, and there's going to be more of that work going forward if that's still the case. So we've spoken to Daniel's colleagues, and we're looking at how the system can work together, so we use all the levers that are available to us to work together to try and open up visiting where there are genuine concerns and fears, so that those homes feel supported and the family carers feel supported. So thank you for that, Daniel. Lee, can I move to you, and perhaps you can cover off adult social care?
Yeah, of course, thank you. I probably haven't got a massive amount to add to Daniel, because we work in the same organisation and actually quite closely our teams work together. I suppose in terms of what we've done, I'd echo what Daniel's already said. We've provided advice, support and guidance to the care market. We've issued millions of items of PPE through the Sussex Resilience Forums. And we've also kind of been individually supporting care homes, as we've already discussed just now, but particularly where there have been outbreaks, individual support to care homes directed at supporting them through those very difficult times when they've had unfortunate instances of lots of people passing away in certain homes. but also more general support across the wider market. So trying to help disseminate some of the guidance that's come down from the government, and share it where we're able to as well, and maybe have some kind of West Sussex slant on that in some respects as well, because West Sussex will have a local response to the government guidance as well, particularly where it is actually guidance rather than statute. In terms of how that's kind of made a difference to the families and carers, again, along the similar lines of colleagues have already discussed, hopefully supporting the homes in this way has helped the homes make access to families and carers more useful and more deliverable, really. In terms of doing things differently, again, the timing issues, as Daniel's already said, would have been a huge kind of, hindsight's amazing, but actually, if we had access to know how things would be communicated from government, and we could have predicted that some of the issues that might have slowed us down in issuing some guidance and some responses to care homes, particularly when we see politicians making decisions on television, the guidance is then trickles down through the systems to reach local authorities and health. And I think, I suppose the other thing to add as well is in terms of actually how the council have supported the care market, and hopefully that has got across to the way that they work with carers and families, is just that from West Sussex point of view, we've distributed millions in adult social care grants from the Department of Health and Social Care. So I think roughly around almost 5,000 payments have gone to individual care providers across Sussex to support them with being able to access additional staff, additional PPE, and hopefully just help them support the people that live in the care homes and the people that care for them and things like that as well. So yeah, I think that was all I had to add on that.
And a pledge, if you thought about a pledge?
I think that the pledge really would be to continue doing what we're doing. The feedback from a lot of the care providers has been positive, for particularly things like our new forum that we've introduced for the care providers to talk to them around sharing information, but also get feedback from the care providers about how we can support them better to help people. So I know Rosemary and some of her colleagues have been involved in those care provider forums, and hopefully they found them useful in terms of just as a group to be able to discuss issues with care homes and access to the council and its partner agencies.
That's a good segue straight into Rosemary then, isn't it? Well done. Thank you, Lee.
I knew she was next.
Thank you, Lee. And I would support what Lee said. We are, if anything has been gained by this last year, is that we've had a much better understanding and working relationship with West Sussex County Council, with each other, supporting each other. And I was underlining the most important thing in everything that we're doing is communicating and supporting each other. And I think that's really where I'd like to say, working with families and carers to provide the best possible outcome for our service users is all about communication, really, supporting each other and working with families, because we all want the very best outcomes. They want the best outcomes for their loved ones. We want the best outcomes for the people we care for, who do become our family, and over the year have very much become our family. But we also have a responsibility to staff, and we have to ensure that they're working in a really safe environment. I wouldn't like to say it's fortunate, but I haven't had COVID in our care home in either of the waves. And I think the fear now of getting it at this late stage is nearly as bad, probably, as the people who have had it, because it's the fear of the unknown. But I think what the complicated thing is, there's 4 different types of visiting. I don't know if everybody has picked that up, but we're now asked to accommodate 4 different types of visiting. One would be the essential visitors, who take on the role of a carer and are treated as a member of staff and can have PCRs and lateral flow testing. One would be the nominated visitor, who can come and see their loved ones, and that's difficult. How do you say to two sisters you've got to choose? One would be what we perceived as the window or the screen visiting, and one would be for people needing to visit their loved ones at the end of their life, and trying to support people to have a good death with their loved ones. I've just had a call while I was here. Grandchildren sitting with their grandma, both have to be laterally flow tested every time they come in. So, and each one of those has got a different process for testing, recording, all in having to wear PPEs. And I've just come off an infection control meeting. And do visitors have to wear gloves? Or is it good enough to wash hands? And that's been, again, two bits of conflicting guidelines. So that's been taken back up to the powers that be. I don't know if anybody on the webinar from my colleagues in public health know the answer for that one, but it caused some discussion at the meeting today. So I suppose everything is working within the guidelines. Everything is working to the best possible interest of everybody, the service users, the staff, the families. But I underline all the time, it's about communication, it's about partnership, it's working through problems rather than hitting them head on, identifying concerns, and just, but I do think the pledge would be to continue the really good things we've learned from the last year. And we've learned a lot. And even if it's just that we need each other to get through difficult times is what I have learned.
Thank you, Rosemary. And I think that was very well put. It covers off both the continuing uncertainty and fear that homes face.
And there is, Katrina, there is.
Yeah.
Because I think what worries people is that if you drop your guard because we think we're out of it, or because our numbers are down, or because we've had 2 vaccines, we're out of the woods. And I don't think we are. So I think we have to continue to keep, you know, everything as safe as it can be.
Yeah. So I think it's about acknowledging that fear from everybody's point of view, isn't it? And I think you mentioned the first person to mention about communications there, and I think that is absolutely at the heart of a lot of this. And sometimes when we've heard people's stories, that's often the bit that falls down on. And when you're sitting waiting for information, it's very frustrating when nothing comes. But similarly, you've also covered off the point about the devil is in the detail, isn't it? And when that's uncertain, that in itself causes conflict and issues as well. So I don't want to ignore Jackie, that you're on the line. I don't know if you want to add anything from the health perspective that your colleagues haven't covered yet.
You're on mute, Jackie.
Okay, then perhaps if I can open it up to our audience, our wider audience for questions.
Jackie, you're on mute.
Thank you.
Still on mute, Jackie.
I just wanted to say that I myself have lost somebody to COVID, my mother actually, and have experienced all the difficulties that you're all articulating now about visiting, having that limited even at the end of life. So I do feel that quite deeply for everybody who's been through this experience. It's not been a normal process, if you like, of where you can grieve for your family and visit them regularly. So I'm coming from that perspective. The other thing I'd like to say is, actually, I'm really proud of, well, I think one of the major things we've done is try and make that communication between the guidance and care homes a little clearer. So we've worked together as a system, and where there's, you know, sometimes the guidance has been a bit confusing, so we tried to work our way through that together. The other thing I think that I am proud of is actually the way the vaccine program has been rolled out so so rapidly. And I did actually write down some figures, which I will get up for you now. But basically, at least across residents of West Sussex, we've achieved about 90.6% vaccination rate. And in care homes, 98.9% have been actually visited for the first vaccination. And as the community infection rate reduces, I think we now only have 11 outbreaks. And when you think of how far we've come since the beginning of the year, that's quite dramatic reduction. And I think as a result of that, and the outbreaks continue to decline at pace, this will help care homes have the confidence to facilitate home visits.
Brilliant.
So we will continue to support that, really.
Thank you, and thank you, Jackie, for sharing your own personal story there. And I think it speaks to the depth of how many people's lives are touched by this. So Sonia has asked Daniel if you could put in an email address for our audience into the chat, if that's fantastic, done as if by magic. We've had a few pre-questions. Obviously, we've got the government's roadmap now, which proposes pretty much, if everything goes to plan, that things will be much more open from the 21st of June. And one of our audience members has said, as that relaxes, will care homes still be subject to restrictions? And if so, will they vary accordingly to each home? So perhaps that's, as you're on my screen, Daniel, a question for you.
Okay, thanks for that. I mean, I hate to use glib sound bites, but the government keeps on going on about data, not dates, don't they? So I think they've said that the changes will take place not earlier than the 21st of June. And I think one thing we've all learned from COVID is it's a rapidly changing landscape. It's very difficult to look into the crystal ball. I think, as Jackie's just pointed out, just in the last month, the last few weeks even, we're now living in a very different landscape vis-a-vis COVID. You know, Jackie noted we've only got 11 outbreaks on the books, and the definition of an outbreak is where the last case was identified within 28 days. So it's likely that the last case was identified a long time ago. And I think you can really see the impact that the vaccine is having on the COVID picture in West Sussex in care homes. I look at every outbreak every day. I get a list through from Public Health England. Today, no outbreaks at all in West Sussex anywhere. You know, compared to a month ago, it's unbelievable. So, you know, going forward, if we look at the 21st, that is a way away down the line. And if we continue to see this decline, I think, you know, it's likely there will be an easing of restrictions. You know, we're supported by vaccines. We're also supported by the sort of community testing program. That said, as Rosemary's highlighted, I think we're not out of the woods, and there's still maybe sort of unexpected things happening. I think it's likely that there will still be an emphasis on those basic messages around hands, face and space. How that pans out into care home visiting, into the nuts and bolts. I mean, if we carry on at this pace, I think, you know, the sort of kind of quite tight restrictions we're seeing at the moment will be able to be lessened. I think that there will be some sort of general guidance in the background for everybody, not just care homes, around keeping those basic messages in place. But, you know, once again, I don't think any of us has a crystal ball as regards coronavirus. We can't tell. So, you know, let's hope that's the case. I think there still will be ongoing guidance, if not restrictions, but they will, if we continue at this pace, will be no way stringent. And we're now operating in a very different landscape to we were a couple of weeks ago as the vaccine program kicks in and we start to see the effects.
And we're starting to see those second round of vaccines happening as well. So that further adds to the opportunity, shall we say, because obviously there's people like hairdressers that haven't been enabled to go into homes, and as you can all see, we're all desperate for that in the community, but it is part of living your best life, to have things like that, particularly for people that, you know, have been without that for a little while. So I think it's also people asking, when are those sort of visitors also going to be enabled back in to support residents?
Well, I mean, there is a national, sorry, Daniel, there is a national date for that, isn't there? But I think we must remember that care homes are private providers, and it depends on how secure they feel about letting somebody like that in. We've got to remember that, you know, this is all we've been talking about is guidance from the government. Actually, in the end, it's how care homes actually interpret that guidance and how confident they are really in allowing that relaxation. And I think, given the trauma that many care homes have been through, they've had a terrible time with losses, and they care very deeply for their residents. So I think that's something that, as I'm saying, it's a question of confidence as much as anything else, and being able to feel the vaccination program really is bringing down that rate, that transmission rate in the community and also in care homes themselves, and making their residents safer. So if they got COVID subsequent to this, they wouldn't be as ill. So that's kind of like what I think that has to filter through. And as statutory providers of services, we can only influence that a certain amount. We can't do that. We can't really, it's up, in the end, it's up to the managers and the owners about how they handle that.
Thank you, Jackie. We'll come back to that in a minute. I just want to invite Sonia in because she's got her hand up. I'm not sure if it's about the same point or a different question, Sonia.
Oh, thank you so much. And could I just ask, Daniel, could you put yourself on mute, because I keep getting a feedback, and I know that, and I was thinking it might have been you. So thank you. Jackie, I absolutely thank you for sharing your story, first of all, and I absolutely, totally agree with everything you've said. However, I just want to say to you that family friend carers also care very, very deeply for the people that are in the care homes. And I think that what we must all consider is that, getting back to Padma's triangle, is that family friend carers want to be part of the solution. And what it feels like often, and this is what we get feedback about continuously, it feels as if they're thought of next. You know, so it's the government restrictions. Absolutely, totally. We're so delighted, aren't we, that actually infections are down and the vaccinations. And I'm so thrilled that we, along with you guys, have been able to enable carers to have vaccinations. So that all of the above. However, what carers want to do is they want to be in the room with you. They want to be part of that solution. They want to be talking to the care home providers, invited to that forum to talk about what the solutions are for them, part of the communications. It is going to be very, very challenging for care homes to be inviting these hordes of relatives back in at some point as well. So they want to be working alongside. They are partners. And I was so delighted, Rosemary, to hear you say about partnership. But what we want to make sure, and this is why we're championing this all the time, is that unpaid family friend carers also care very deeply, and they want to be part of the solution. And it's really, really important that I say that on their behalf, because we have heard through these webinars, but also through the many, many calls that we get, the absolute pain that mothers, brothers, sisters, we're not just talking about carers, you know, people, older people have felt through this process. So it's just that being part of the solution is what we've always wanted.
And there might be an opportunity going forward, you know, now that we've made these connections with family carers, that they're, forgive me for calling our audience an asset, but they are a fantastic asset to help decision makers and talk through all of these thorny issues and the problems that are faced by the providers. And I think what you're saying there, Sonia, if I may put words into your mouth, is that the providers don't have to be an island on their own. It is about coming together. And if we can all encourage care homes to have that open transparentness about them, being clear. And I loved, Rosemary, you saying, is it gloves on or gloves off? Is hand washing okay or not okay? You know, just being open and honest about that is heartwarming, because you think, well, yeah, if you've got two sets of guidance coming at you, one saying one thing and the other saying the other, and we've seen a lot of that, haven't we, Daniel, that there's constant, you know, one lot of guidance gets contradicted. And I'm sure we've all read the guidance on visiting, and we could probably have there's 24 people in this call, 24 different interpretations of that. And it's just trying to find within the care home community, working with family carers, that common ground that everyone can agree. There is a question about outbreaks and whether there is a local interpretation around what we would expect of care homes or the systems to communicate when a home is in an outbreak. And no matter how good we are with the infection controls, we can't say they're a thing of the past, although it's brilliant that we haven't had any reported. So Lee, is there a communication protocol in all of the policies and the local guidance?
In terms of when an individual care home's in an outbreak,
yeah,
they will have their own policy on how they communicate and who they communicate that to. We would expect that they are communicating widely with carers, family representatives, anyone who may want to visit or may need to visit, and keep them updated on the progress with the outbreak. So that would kind of, yeah, that would be our response to that, really. I think the guidance is quite vague about what should be communicated when and by who, but ultimately the care home is probably best placed to communicate with people in that instance.
And do we have a system-wide policy on any of this, or is that basically our policy is that it's down to the providers?
For communication to individuals and people representing or supporting or caring for those living in care homes, that would be the process. Sort of within the health and social care system, we have obviously public health reports on outbreaks on a regular basis to health and social care, and that's predominantly for us to target our support and our intervention to care providers as well. So I think, yeah, I think Dan would probably be best placed to discuss what information is available to the public.
Katrina, I think under that one, it would be under our duty of candour, CQC regulations, where we are required to be open and transparent, and our duty of candour, that would be if somebody had a fall or anything of that nature, then it would be our responsibility to tell families. So from our perspective, in the first wave, we had a couple of care staff, not at the same time, testing positive, and we told the families immediately. So that would be our legal responsibility.
Thank you. That's worth knowing about, and hopefully some of our family carers will benefit from that answer. Thank you, Rosemary and Lee. We've got a question for Babu.
Katrina,
Thank
it's
you.
me.
Hi.
Yeah,
Sorry.
hi. Yes, I'm Boba Angelov. I'm a patient public engagement manager for Surrey and Sussex Cancer Alliance. Sorry, I can't stay the whole meeting, but I'm just going back to what Sonia said. I completely agree with you. The thing that we will be doing, that I will be doing, there is a cancer patient experience survey, national survey, and we analyzed the latest report, 1920, for Surrey and Sussex. And we identified areas with the lowest score, where providers actually scored the lowest, and areas that need to be looked at in a bit more detail. So one of the areas is actually, which I will be exploring across Surrey and Sussex, is related to involvement of carers and patients in care planning. So I think that's really important matter. And being ex-carer myself, I know how it's important to have carers involved in care planning and decision-making about care plans. So I just would like to point out and completely agree what Sonia said, that it has to be done jointly, whichever care planning is health professionals are doing. It's really important to get both patients and carers involved as equal partners. But that's going to be certainly one of the areas which I'm going to be starting really, really soon.
Thank you. Thank you very much. And thank you for joining us.
It's okay, on my day off.
Especially on your day off.
Yeah.
Thank you. So he's put in the chat that Skills for Care are doing an excellent promotion on working in partnership and have interviewed providers. Perhaps you can tell us a little bit about that, Zoe?
Hi there, can you hear me? Yeah, hi. Yeah, they're doing an excellent piece of work in working in partnership. I think sometimes it can be quite daunting for some managers, for some homes, to work in partnership, especially in this new world. So they are seeking views of providers who have managed to do that with not only healthcare professionals, but with their relatives as well. I think many of you know we make decisions with all of our relatives and write our policies with our relatives as well. And Jo, who I think is on the call as well, you know, she's a great believer in saying to me as well, actually, it's okay to say I don't know, but I'll go away and find the answer, or let's make a decision on the answer together. As Rosemary said, you know, we've talked to our relatives already about, do we wear gloves, do we not? What decisions can we make? And that decision can be different for each individual resident as well. It's not a blanket decision for the care home. So I think when that video is released, I think that's going to be really beneficial for providers who are maybe struggling in doing that as well.
Thank you for that. And that's something that we can share with the family carers once that's available as well. But do we, Susanna, your hand is up and you're on mute.
Yeah. Hi, everyone. I just wanted to say I'm listening to lots of, thank you, Sonia, for saying what you said about our carers and working on the front line with carers. What we frequently are listening to is the three things which they raise as concerns. The first one, I don't know whether this is for the next session or for this session, family carers are really concerned about the vaccine and whether it's going to be mandatory for any care home staff, because they are getting various feedback on that. And that is the biggest concern, especially when we go on to the next thing, the frequency of the visits, the 4 types of the visits, and what the family carer has to go through, and what's the point when the care staff isn't going to have a vaccine or it isn't mandatory. And the third kind of concern or an issue, which I heard throughout this hour, is a lot of people are saying how each care home will interpret the guidance differently. And this is really worried for our carers, because, you know, it could be like, I know we're trying to follow the guidance and put the best practice in place, but if we don't know what is the very basic that's acceptable for the care homes, it is going to cause the concerns. And I think our carers who have people in care homes, especially in I think we hear a lot from dementia carer, people who have somebody in a dementia care, and they are very, very in a very upset place, especially kind of often we hear, well, I will never forgive this government if so-and-so doesn't survive this, and I haven't touched their hand and I haven't spoken to them, etc., etc. So anyway, sorry, Sonia, I'm not hoping you standing on your toes, but
no, that's brilliant. Thank you. I appreciate that. And that was very honest questions. And it is one of those what can we expect? And Rosemary, I'll bring you in there as you've got your hand up. And then
I'm on my iPad and I haven't got a hand to put up. Susanna, I totally agree with you. I don't think there's a how we interpret the guidelines. I think we get guidelines that are contradictory, like the gloves. And I don't think any care home really goes out of their way to deliberately misinterpret to their own advantage. But I do think the guidelines give us, as I think Lee said or Daniel said earlier on, we get so much conflicting guidelines that gives us so many problems. But secondly, that the jury is certainly out on whether or not to make the vaccines compulsory. I think that I was on another national call today, and of course we were very lucky in our area that most of our staff, absolutely most of our staff, have had the vaccination. It does not work like that throughout the country, and I think care providers are worried that if they bring that in, they will lose their staff, and in really good staff are really quite hard to get in care homes. Equally, is it going to be a level playing field? Because they're talking about bringing it in care homes, but not the NHS. And even the Hep B in NHS is not compulsory because it protects the worker and not the service user. But obviously with vaccines, it's the other way around. So I think there'll be a great deal of disquiet about human rights and legal cases if it does get implemented. But the jury is out, really, and I think it's going to be very, very difficult problem going forward.
It seems a simple black and white, as you say, Rosemary, but it's very, very complicated, isn't it, in terms of that very factor of if we introduce that as our policy, which as individual businesses a home could do, then does that then mean that our good workers
won't come to work
because of that? So it's very complicated, and I'm going to go and ask Dame Philippa Russell, who I know's had national conversations about this, whether you have anything to add, if I may. Sorry to put you on the spot.
Well, Rosemary's absolutely right. There's an ongoing debate about whether vaccination should be mandatory for certain occupations. It is mandatory for some people working in the NHS, for example, particularly surgeons. They cannot go into an operating theatre unless they are vaccinated and can show that they are against hepatitis B. Vaccination is required on a voluntary basis in some private health settings, but that's voluntary. With regard to health and social care generally, there are discussions ongoing as to whether vaccination should be mandatory or not. I think West Sussex does pretty well with regard to care home staff being willing and able to have vaccinations. In London, where my main home is, the numbers of refusers working in care home settings is going up. Mostly younger people, mostly people from particular ethnic minority backgrounds, but work is going on with their community leaders and others because there's a lot of false information about. And I think if we get the right public health information out, we can get some different results. Now we're talking about care homes today, but there are also some interesting debates about what happens for people like myself with my adult disabled son, who actually has a personal budget and is in supported living in his own house. Do I have a right to say that anybody coming in to support him must have a vaccination? Now, I actually am not prepared to accept somebody who is unwilling to be vaccinated, unless they've got a good reason. Some people can't have the vaccination, and that's fair and reasonable. And I think there's a view that where it is one person, like a family carer living in their own home, or their relative lives in their own home, they can actually ask that person should have a vaccination if they wish to be employed. But some of the leading QCs say that that still might be regarded as discriminatory. So legal opinions are being sought. I'm giving a rather wrong answer, which does not lead you to conclusions. But I think we've got to have some honest and open debates, haven't we? We're talking about care homes here, but there are equal debates about teachers, about other professions, about schools. And some of our EU neighbours are taking a very firm view about vaccination, and a lot of anti-vaxxers in their population, but they're taking a view that certain professional groups ought to be vaccinated. So I think we've got to watch this space, but I'm very keen that the families, that the public sector, Public Health England, social care, the NHS, very importantly care homes themselves, should join in this debate. What do all of you think is fair and reasonable? I think there will be some sort of consultation of some kind fairly soon. So I think we need to think what the bottom line actually is. It's challenging, particularly when in West Sussex, your vaccination programme has really gone so well and so quickly, and of course for celebration.
Thank you. Thank you. I'm very conscious of the time, and I'd like to say a massive thank you to our panel who have joined us. We do run these sessions in two parts. The first part is our recorded, sharing, publicised part of Q&As, and our second part is the safe space of which family carers can stay on. So we're going to ask our family carers to stay on for the part two if they can and they want to. Thank you to our professionals. We want to make sure that we continue these conversations, and going forward we are seeking to ensure that we are all working collaboratively as we started this conversation. That's at the heart of this. This is about individual care home communities, but our wider West Sussex community, and we want to get this right for each and every one. So I appreciate this has eaten into your family time. Thank you so much for everyone that's joined us. We wish you well, and we look forward to continuing these conversations. Thank you again, everyone. Family carers, if you can stay on the line for us, thank you very much.
Thank you.